On Sweetbriar College's psychology department website, Kim Schmidt tells the story of Paula. Paula was severely sexually abused as a child. When she began taking night classes at 38, her professor learned of this trauma and discovered that she was experiencing periods of amnesia. So, he referred her to a psychologist, Dr. Hartman, who discovered that she possessed 5 distinct identities, all with different names and very different personalities. Hartman diagnosed her with dissociative identity disorder. Patients suffering from dissociative identity disorder, or DID, unconsciously create alternate identities that take over various aspects of their lives. The presence of multiple identities causes various symptoms, including memory loss, flashbacks, and hallucination, and the nature of DID makes it very difficult to treat. As a dual enrollment student pursuing a pre-medical degree, and as an AP psychology student, I am fascinated with disorders like DID. So, I turned to websites such as that of the National Alliance on Mental Illnesses to learn more about it. Based on my research, I'll explain exactly what DID is, what causes it, what its symptoms are, and how it is treated. So, what exactly is dissociative identity disorder? Dissociative identity disorder, formerly known as multiple personality disorder, is a condition in which patients possess 2 or more distinct identities. As in Paula's case, these identities often alternate outside the patient's awareness. Each identity possesses distinct personality traits, such as posture, emotions, and vocabulary. Each has a different name and may even exhibit different handedness. Paula possessed 5 distinct identities. The original, a 30-year-old woman named Sherry, an extremely angry teenager named Janet, and a 5-year-old girl named Caroline, and a suicidal author named Heather. There is usually one identity that is aware of the others and will seek psychological help. One of Paula's identities, Sherry, was aware of the others and told Dr. Hartman about them. You may be wondering what causes sufferers of DID to develop multiple identities. According to the online psychology encyclopedia, DID evolves in people, usually women, who have suffered intense emotional trauma, usually in the form of severe physical abuse. When they can't cope with this trauma in conventional ways, DID patients create alternate identities, each of which helps them cope with or express their inner turmoil in a different way. Paula presents one example of how DID patients cope. Each of Paula's identities express different aspects of her emotional instability. Sherry was created probably during her childhood to protect Paula and help her cope with her father's sexual assaults. Janet, an extremely angry teenager, was responsible for Paula's blatant alcohol abuse and for her affair with a married man. Janet probably exemplified the turmoil experienced by Paula as a developing adolescent when her father's advances horrifically progressed. Caroline, the troubled 5-year-old girl, represents Paula when her father's sexual abuse first began. The 5th personality, Heather, was created to help Paula cope with her first lover's rejection. The presence of multiple identities, usually unknown to the original person, leads to the appearance of various symptoms used to identify DID, which are defined by the American Association of Family and Marriage Therapies article on DID. Most symptoms of DID are associated with memory loss, flashbacks, or hallucinations. Patients with DID often experience amnesia or memory loss. They may forget large portions of their childhood, or they may experience lost time, being unable to remember what they did on a certain day, or finding themselves somewhere without knowing how they got there. Paula's professor first suspected irregularities in her mental state when she failed to show up to her final exam and could not remember anything about what she'd done on that day. Later, Paula experienced confusion after repeatedly finding her father's gun in her house. Dr. Hartman later discovered that one of Paula's alters, lovesick Heather, was putting it there. Alternatively for memory loss, DID patients may experience flashbacks. Flashbacks are a sudden return of memories of past events. For many sufferers, these flashbacks constitute vivid recollections of traumatic events, usually the physical abuse they suffered as children. Similar to the mental disorder schizophrenia, with which DID is often confused, DID patients often experience hallucinations. Hallucinations are sensory perceptions that are not really there. Most DID patients commonly experience try to integrate a patient's multiple identities into one. Psychologists usually try to achieve this by helping the patient work through the trauma that triggered the dissociation of their identities. Dr. Hartman's attempt to integrate Paula's identities failed because reliving her abuse proved too much for her. It also eventually resulted in Sherry becoming the dominant identity, who refused to allow Dr. Hartman to work with her any further. So, are there any medications that can treat DID? Though its nature makes it impossible to create a drug solely for DID, there are some medications that may help alleviate its symptoms. Specifically, antidepressants and anxiolytics may help with mood disorders caused by DID. Now, to make sure you caught it all, let's review the key aspects of dissociative identity disorder. DID is usually caused by severe emotional trauma that results in the creation of multiple identities within one person. This leads to a wide range of symptoms, including flashbacks, memory loss, and hallucinations. As Paula's case demonstrates, DID is a complex condition, and its nature and causes make it very difficult to treat. Hopefully you will all leave here today with a much better understanding of and greater appreciation for dissociative identity